to be joined with the CEO of MYND Life Sciences, Mr. Lyle Oberg. How are you, sir?
I'm well, Chad.
Excellent. I'm glad to obviously have you part of the TDR psychedelic plans as we sit here and tell more and more stories with some key players within the industry, and obviously doing a little bit of research pertaining to your story. And it's an interesting one, to say the least. So let's maybe start it off to my viewers that are watching. Tell us a little about MYND Life Sciences and why they should maybe be focused on your story from not only from a lifestyle standpoint, but from an investment standpoint as well.
Yeah, absolutely. MYND Life Sciences was formed initially probably about 6 or 7 months ago when I started talking to the researcher involved. And the researcher involved is a gentleman by the name of Dr. Wilf Jeffries, who is a world-renowned researcher out of UBC. And so we were talking about what he was doing, about his ability to bring in psilocybin and to determine how it was going to be used. And we started also talking about his licenses that he has, some of the patents that are out there. Yep. And then he actually asked me to come and help him take this company public, to take it to the next level. Okay. So I did a lot of due diligence myself in the actual process. And being a medical doctor, I wanted to see, does it actually work? Is this real, or is it just something that's a pump and dump, or something that's trying to capitalize on a market that is burgeoning? And what I found was really interesting. They have actually discovered the gene that leads to depression, that leads to inflammation, that leads to the inflammatory response in the human body. And they've also discovered that using psilocybin, they can actually modulate that gene to determine whether or not it can decrease the symptoms. I hesitate to use the term cure the disease, but I use the term decrease the symptoms in depression and many of the other inflammatory diseases that are out there. So it was really exciting. And I decided to jump in with both feet and started to help him take this company to where I feel it can be.
Well, it's interesting, to say the least, from some of the people that you've formed. A lot of companies, and let's face it, a lot of people will pride themselves, in companies within this space that pride themselves around research. And you do hear a lot about, different scientists and different doctors, I guess, being acquired and I guess being associated with a lot of these companies. But yours, I will say, based on what you said with Dr. Jeffries, it seems to be legitimate. Based on some of the things that you outlined already, having him on, I would think, in a way, based on his background and his resume, that's what makes you stand out, let's say, from other companies within the space.
Yeah, Dr. Wilf Jeffries is a very intelligent, interesting man, and I have a tremendous amount of respect for him. He has over 60 patents. He's been published over 100 times. He's an article coming up in The Lancet. He's been published in Nature a couple of times. He was inducted into the Inventors Hall of Fame. He's one of 14 Canadians who have done that. And probably more importantly is that he has a team of 45 PhDs at the Michael Smith Laboratory at UBC. And he was actually the first PhD that Michael Smith hired. Okay. And for interest of your viewers, Michael Smith was a Nobel laureate, one of the few Nobel laureates that we have in Canada, who came out of UBC. So this is in Canada. This is in North America. This is the UBC. This is the Michael Smith Laboratory.
So UBC is, from what I'm learning within this space, definitely is a global leader when it comes to research, especially with what you're talking about with psilocybin. But, walk me through the steps, not only to have a conversation with Dr. Jeffries, but to get him on board. How did that all come to fruition?
Well, obviously, he had to like me.
Yeah.
I had to like what he was doing.
Yeah.
This was something that, with my background, being former Minister of Finance, being former cabinet minister in the government of Alberta, it was something that I didn't have to do. It was something that fascinated me, and it was something that I think can, not to speak broadly, but can help the human condition. I feel that strongly about it. I think it has a huge amount of potential to go forward and help all inflammatory diseases, not just depression. And so we started talking and we started planning, and we brought a team on board that has the ability to move it to become a public company, which we're certainly looking at doing. Yeah. And subsequently move it through the exchanges.
Yeah. Well, let's talk about the current state of affairs. I was reading over the weekend an alarming stat, to say the least. This is not only in Canada, but globally, that one in every 10 people have actually contemplated suicide since COVID, which is an alarming stat. It's like one of the leading causes of death now. The psychiatric industry basically has been in dire straits for quite some time. Um, what do you plan, I guess, to revitalize that? And, our company seems to be poised, I guess, to bring it back to life and point it in the right direction. So, first off, how did it get to this point? And I guess what needs to be done moving forward?
Well, first of all, you have to go back to the roots of psychiatry.
Okay.
And the roots of psychiatry are a thing called a DSM manual, which is a diagnostic and statistics manual. And
Okay.
what it means, to the layman is that when you have a group of symptoms that are together, make a disease. So it's
Okay.
not as though you can go in and get a blood test or do an x-ray, nothing like that to determine that you have a disease. Well, we're at the point where we may be able to say, go have a blood test, go take an x-ray, we will tell you what disease, what psychiatric disease that you have. We're that far along that we will have that ability to diagnose. It won't be an x-ray, it won't be a blood test, but it
Right.
certainly could be a chromosomal test. It could be a gene analysis. It could be a SNP analysis that could actually tell you if you physically have the disease, which is huge when it comes to basically the major depressive disorder, which is what we're looking at the moment. It's a huge step forward to be able to do that and subsequently have a treatment for it. And if the numbers that you said are truly astonishing.
Yeah.
1 in 10, if the viewers look around your neighborhood, 1 out of every 10 people that they know will potentially have contemplated suicide. And if we can make a dent in that, if we can stop
Mhm.
some of that by what we're doing, then we have a company that's second to none in the world.
How much is, I guess, the current situation with COVID have an impact? Like we've noticed, it's speaking to the community here, the way this industry is progressing at such a rapid pace, especially over the last 3 months. Obviously, COVID obviously has to play a factor into that. Do you believe that?
Yeah, absolutely. I think when, again, if you take a look at your friends and neighbors, how many of them had a really cheery disposition and were doing great, and then over the last 9 months have just kind of deteriorated in their mental outlook. And we really feel that we can do something about that. 9 months of being stuck in
Yeah.
COVID hell has not been kind to a lot of people that had borderline mental illness in the first place.
Yeah, it's definitely an alarming stat. And I applaud you, obviously, with what you guys are doing and how to make a change. One thing that obviously grabbed my interest as well is that you're one of a few Health Canada licensed companies, to research and extract psilocybin. So, based on the team that you formed, how were you able, I guess, to achieve that right away? And when I look at the amount of licenses that you have within Health Canada, it's a very eye-opening amount, to say the least, that I think a lot of investors should take notice of when they're looking at the success of your story.
Yeah, so between Dr. Jeffries and myself, we have no interest in doing anything that is gray, anything that is illegal.
Right.
So first and foremost, we had to have the licenses to do it. And Dr. Jeffries went out a couple of years ago and started doing the paperwork on getting the licenses, and indeed has a lot of the license, something like 90% of the licenses that have been issued in Canada for psilocybin we now possess. So we're in a great position to move forward.
Right.
And the other side of it is we're not in the business of setting up clinics to see if this works. We're beyond the if psilocybin works. We're into the how and why. And that's really, really important as you move towards FDA approval, as you move towards Health Canada approval, as you move towards a true pharmaceutical approval. You do have to know the how and why the medication works. And that's what we're looking at doing. And that's what we have the capability to do. And we think we can do it very quickly.
Will this change the whole outlook on healthcare, you think, in the next, I don't want to give a timeline, but where do we see ourselves within this industry in the next 12 to 24 months?
That's a really interesting question. And being an eternal optimist, which is what I tend to be, I believe that it could really have some long-term effects in the role of inflammation in disease. I think we all know that inflammation is generally bad,
Right.
whether it's rheumatoid arthritis, whether it's sepsis, and even COVID. I'll give you an example, Shad, if I
Yeah.
can. In COVID, you don't die because there's too many viruses in your body. You die because of the way your body responds to it, and it causes a thing called cytokine storm, which causes an overwhelming amount of inflammatory
Interesting.
process and inflammation. So that's how you end up dying in COVID. And it's if we're in preclinical stage at this point, but if we can change that, if we can stop that cytokine storm, if we can stop that cascade of events, we can save a lot of lives. And if we can stop or change the inflammatory processes, just think of what inflammation causes.
Well,
You've got depression, we've talked
yeah.
about. You've got rheumatoid arthritis, you've got inflammatory bowel disease, you've got multiple sclerosis, the list goes on and on. And if we can make a dent in that, I won't say that we're going to have the magic be all and answer for it, but if we can make a dent in that, we will truly have improved the human condition.
So help me better understand when you say inflammation, how does one accumulate? And is this something that is formed over a short period of time, or is this over like years in the making?
Well, I think there's a combination of both. In something like COVID, for example, or in cytokine storm, it's formed over a very short period of time. And when I say that, we're talking minutes
Right.
to hours to days.
Right.
But in some of the longer term ones, for example, multiple sclerosis and rheumatoid arthritis, it's something that the body is in a continual battle with all the time.
Hmm.
And so it's battling that inflammation, and sometimes it wins for a little while and sometimes it loses for a little while. But overall, the inflammatory response is what causes a lot of the conditions. And in rheumatoid arthritis, for example, if you've ever seen anyone with it, their joint is red,
Yeah, for
right?
sure. Yeah. Okay.
It's
Good
red,
point.
kind of knobby. Well, that's the inflammatory process occurring, but it's not like that all the time. It comes and goes.
Hmm. Business fundamentals. You recently raised $2.4 million in a private placement deal for the friends and family seed round. I take it, obviously, everything that you explained was a big interest with your investors that obviously were interested in investing in the company.
Yeah, absolutely. It was very gratifying to see how quick that money was raised, where it came from, the interest, the general interest, first of all in the space, but the general interest of what we were doing was pretty incredible.
Good for you. Well, listen, I appreciate the time. I love the idea of like the company that you've, especially the team that you've built out, and interesting points to say the least about, just the form of depression through inflammation. And obviously, we'd like to keep in touch with you and keep this story going. And we really applaud with the initiatives that you're trying to do to make a difference. And we wish you all the best.
Thank you very much, Chad. I really appreciate it.
Thanks, Lyle.